Where did you sleep last night? Question is, what did you sleep on? Your mattress, because it has a big effect on how you feel the rest of the day. And for advice on one that will treat you right, we turn to Dr. Riley at Tulsa Spine and Rehab. Sean, I suppose there is a big impact a mattress makes in a person's day and how well they can get moving.
The most common question that I get here in the clinic.
Is it really?
Daily. I mean, I feel that question multiple times, and throughout my history taking or consultation with patients, and one of the questions that I ask them is like, do you hurt more in the morning? Mm-hmm. And many times the answer to that question is yes. So the first thing that I want to talk to the patient about is their sleeping environment. My job not only is to figure out what's going on with them and make the appropriate recommendations, but also if I can make environmental recommendations, whether it's ergonomics or mattresses, that's half the battle too. So I want to make sure that during that consultation, it's very comprehensive and I'm listening to different things and picking up on different things that might lead me down the path of, hey, what's your sleeping environment like? And many of them, I get so many patients, Charlie, that I'm my mattress 12 years old. Holy cow, that is old. And I don't want to get backed in a corner, but I think they say that every 8 to 10 years, you should be changing out your mattress. And it's just technology breaks down, and that mattress does a really good job early on. And as we sleep on that thing every night, it starts to break down. It doesn't provide the amount of support it did 8, 9, 10 years ago. So I think look at the time frame, look how long you've owned your mattress. I think that's the first thing. And
what about, you're looking at this mattress, what about the type of mattress? You said support, firm, medium, light. What kind of support do you recommend?
I always recommend firm. And it's challenging many times with your spouse that we might respond to different things. But a firm mattress is going to give you the most support, okay? And on that note, I always recommend to my patients to stay away from any type of pillow top mattress. We're all familiar with those pillow tops. And the problem with those pillow tops is that over time, that pillow top starts to break down and you'll start to see some cratering, okay? So two things happen here. First off, I have limited support. And then secondly, it changes my mechanics of sleeping, and it might not allow me to move around as I should. If on my side, I want to get to my back because you're essentially sleeping in a dip or a crater. The issue, too, with those pillow tops that I've noticed over the years, man, those things are so darn comfortable in the showroom. I mean, I'm talking whoever developed those things was a genius, because I will have patients argue with me like, Dr. Riley, this thing was the most comfortable thing I tested out. Darn right. Give it 4 months. And I'll be darned. It's like just within the first 6 months, those things start to crater and break down a little bit. So I'm not like one brand over another. I've never really made those specific recommendations. I talk to patients about firm is always better than soft, and then I would stay away from pillow top mattresses. I'm a huge fan of Tempur-Pedic personally. I have one. My wife and I, it was pretty challenging for me to use initially because I didn't have the best bed, and then I went from a mediocre mattress to a Tempur-Pedic, which was very, very firm. I think we're going on like 6 years on this thing, and the dynamic hasn't changed, meaning if you were to take the mattress pad and everything off, you can't see any type of dipping or concavity there that would indicate it started breaking down. So Tempur-Pedic I'm a fan of. I'm getting into these sleep numbers a little bit. And what's great about these sleep number beds is that you can buy the dual zone where you can actually – your wife might like very, very firm, and you might like mediocre firm. And so you have the flexibility and the ability to change the sleeping. Also, they're offering some mattresses that will start to elevate a little bit and give you a little bit of tilt. Sometimes people have sinus problems, sleep apnea, those types of things, and maybe a little bit of a tilt could reduce some of those symptoms as well. So I'm doing more research, but at the end of the day, Charlie, it comes down to resources, and this is why it's very challenging to have these conversations, is that I can make the recommendation for what you need, but at the end of the day, it's like, what can you afford? And that's a reality of life. And so I recommend that we do our research. Many of these companies will have 60 to 90 day return policies, which I think is fantastic. Get online, read reviews, do those types of things, and take your time. I think many of us, we get in and we get the salesperson that's the end of a sales cycle, and he's really pushing to make a few sales, and he's always going to start with the most expensive mattress. So it's tough. We test drive these things for an hour, and then they end up at home, and then that's in our bedroom for the next 6 to 8 years. And so it's important that we do the research. And I always tell patients, I want to be a resource for you as well. Meaning if you start to do research and you've got it narrowed down to 3 or 4 different types and brands, I'm happy to give you I'll do my own research on the back end and give you my maybe top 3 on those or whatever the case may be. So I think it's important that we take our time and do our research on these as well.
So you'd prefer not to have one of the spring mattresses and be more of the Tempur-Pedic mattress instead?
Now that's personal because I think there's some really good products that have traditional spring type mattresses and some of the new technology that provide a fair amount of support and are very firm. I'm just speaking from personal experience. Just like many times I have conversations with my patients, whether it's exercise routines that I do or things that I do to promote health personally, I have experience with it. And so that's why I make that Tempur-Pedic recommendation. But I do think that there's traditional mattresses out there that are very good as well.
Choose the right mattress, sleep better, and get moving better. That's the bottom line to choosing the right bed, and you'll have less of that morning back pain, which is, by the way, Sean, the #1 most viewed page on the entire website.
Nice.
Sean, thanks a lot for helping us out.
Thanks, Charlie. Appreciate it.
And learn more about how you can take better care of yourself here at TulsaSpineandRehab.com.